Hello everyone, Professor Money Peak Trading. This is a video for the member. On January 6, 2022, we actually identified a very interesting, holy shit, Biogen continuing to drop, biotech called IOVA. Basically what they do is they focus on cancer therapeutics, and the way they cure cancer is actually really cool. What they do is they actually provide a T-cell therapeutics. Basically, what they do is you take out the solid tumor from patients, and then what they do is in the lab they use those tumor to generate some antibodies and then they will put the IV of those antibody back to your blood, so that will induce the immunology, your T cells basically, to generate antibodies that can specifically kill those tumors. So this is kind of like a last line treatment, and basically the side effect will be less because you're using your own antibody to focus on killing those solid tumors. So it's not like chemotherapies that is actually killing a lot of good cells as well, which will cause hair loss, your weight loss, all those things. So it's a really powerful way, thinking about it, to treat patients in the late stage of cancers. Right now, if you look at their pipelines, this website is actually will give you a better overview, which we use a lot.
Looking at your final market on closing balance, still on the buy side, but did come back a lot, around 100 million on the buy side.
That's just a trading news desk, the vendor we use for real-time trading news. You can get the deal on the affiliate channel, and you can get some coupon and free trials. But back to this IOVA. So basically all they do is focus on some really hard to treat cancers. Cervical cancer, once you found it, stage 3, stage 4, usually metastasis to your lung, to your brain. It's really hard to cure it. All this type of solid tumors cases that they focus. So far, this one is we have seen some really promising phase 3 trial results that patients in those incurable cancer, the way they treated with this T-cell antibody that I just described, this immunotherapy, and actually a lot of patients responded very well, and they responded well in a long time, not just like the first 2 months of being treated, but a few months after being treated, they're very stable. They're able to see those tumors start to disappear or decrease. So the survivability for those cancers in stage 4 usually is less than 10%, and in the phase 3 trial, we actually see about 40% of patients actually survive for a longer period of time. So that means this drug is definitely very promising. The catalyst that's going to come out in Q1 this year is they actually need to file a biologics application because it's not like a small molecule drug. They need this BLA filing before they submit this drug for FDA to have a full review and to get it approved. So once this BLA filing is done in the Q1 this year, we should see some pop of this stock. Okay, how much? I'm still estimating, but it's really hard to estimate. But we should see at least 10, 20, if not 30% pop on this news. Currently, this stock is traded at $6. Okay, and this company has been up for about 10 years, and the stock price actually tanked quite a bit when their CEO actually left the job back to February, March last 2021, and the stock prices continue to tank. The former CEO left because she pursued another opportunity, and you can see on her LinkedIn, she's actually went to another very promising biotech company, CRSP, the ticker name. So it's not really a bad thing, and the current management is actually holding on the company well. And I do think this pullback potentially is actually a great buying opportunity for this promising company. So this BLA filing will actually create a potential upside, right? And once the BLA filing, the FDA will start to consider and approved, and will start to consider review this application and potentially approve this drug. And I think right now I estimated this drug will probably get a FDA accelerated approval, probably Q3 or Q4 this year. Once it's approved, based on the market cap that estimated, this stock should at least pop to $20 to $30. The little problem with this company is a very small company and they never have a commercially available drug. So they don't have sales team, marketing team. So they need to have a partnership with a bigger pharmaceutical company, which we don't see any right now, which is not a good thing for them to push their drug into the market. Because once your drug got approved, that's one thing. Have a successful commercial launch is another difficulty, especially for early biotech startup. So we just have to see in the second half this year, once they file the biological filing, if they can form some kind of partnership. If they do, I think that's a major upside. Maybe we can see the stock price into 40. And if there's any of this immunotherapy that can show some good phase 2, phase 3 trial in 2024, and all these are gigantic market because all those solid tumor late stage, there's pretty much no cure. And there's a reliable cure that can significantly increase the patient's well-being and life. This is going to be a blockbuster drug, basically. And potentially in the long run, 2024, 2025, and the company can get the first one approved, the second one show positive clinical trial get approved, and they can have a successful commercial launch. We're talking about this stock price going up to more than 100, if not 150, based on the market cap that the diseases they're covering. But right now, we're looking at $6 per share. This company does have a problem. Their cash is only good until Q3 this year. So once this biological filing gets sent out and the stock price push up, I do expect they're going to do a stock dilution to raise more cash into 2024. The dilution probably going to be quite significant, about 20 to 30% of the total diluted share. So that potentially could tank the stock price down maybe another 10-15%. Okay, so imagine the stock price pop once this BLA filing to maybe $9. Okay, and then that's probably the time we should take out our swing trading options, which will probably bet 7 called in January 2024 expiration date, and then waited for the pullback on the stock dilution to buy back those call options. In terms of stock, we can just hold it for the Q3 and Q4 this clinical trial approval on this LN144. So that's just a little tricky in terms of the timing. Once this BLA filing upside comes, we do think there will be a stock dilution coming out to tank the stock price. The other thing I definitely noticed, and I think that's a really good sign, is this IOVA has a lot of insider buying. Look at this. November last year, they actually buy quite a bit of stocks with a very decent dollar amount, about $500,000 by their director and CEO. And actually, it's not shown out here, but earlier last year, there are actually more insider buy-ins. So that means their insiders really believing that their stock is going to be successful. So a stock that we think is very promising in 2023 and 2024 is this guy, okay, Iovance Biotherapeutics, ticker name IOVA. Kind of an overview. I know we have a discussion on long-term question channel to a few members, and some people are also pinning about how about this trade. So it's kind of a quick video. Any question, feel free to reach out. I'm going to stop the recording.